All right, let's head now to the United Kingdom, where they too are dealing with a third COVID wave, dominated, like us, by the Delta variant. The difference is that the majority of their population has been vaccinated, and while infection numbers are up in the UK, the jabs have broken that link between getting infected and dying. Let's get our latest from London correspondent Olly Barratt. Hi there, Olly. So, another similarity between the UK and South Africa is that you too have lost your health minister, but for a very different reason to us. Matt Hancock resigning this weekend over an affair that he had with his aide. Tell us a little bit more about that and whether his replacement, Sajid Javid, has hit the ground running today.
Yeah, a whistleblower of some sort in the Department of Health, Sally, leaked a video of Matt Hancock in what the British media is rather coyly calling an embrace with an aide, which took place in May. Now, you may think, look, this is a personal story. Why does that affect the job of the Health Secretary here in the UK? Well, the very specific reason for that is that when he was involved in this so-called embrace with this aide back in May, it was actually against COVID-19 guidelines to get close to another human being in that way who was not in your own household bubble. So Matt Hancock admitted that he'd broken his own rules and therefore had to resign, he said, over the weekend. And you're quite right as well that Sajid Javid, his replacement, really has had to hit the ground running. He's on his feet in the Commons as we speak, setting out the latest data to MPs and saying that there won't be an earlier than planned unlocking of the English economy a week today on the 5th of July. But he does say that that 19th of July target date for England's economy to fully reopen is something that he does believe the government can stick to. And you might find that surprising, given that just today, according to the latest data, we've had 22,868 new COVID cases confirmed here in Britain. The point he is making in the Commons is the point that you started with, that link between cases and hospitalisations and fatalities is being broken. Deaths and hospitalisations remain low, and Sajid Javid says it's possible that they will continue to rise a bit, but he says at some point you have to accept that the economy has to reopen and that that link has been broken enough for something like normal life to resume.
Yeah, and I suppose what the vaccines are doing, and of course you guys are also dealing with Delta, which is what's hitting us so hard, but what it's doing is it's curtailing COVID so that it is no more impactful than perhaps a seasonal flu.
And exactly what Sajid Javid has been saying in the House of Commons, that you get to a point, he says, when the vaccines are working, and he says the data continues to show that the vaccines work against the Delta variant very well indeed, that you won't see the National Health Service overwhelmed by a large number of cases because they're in younger, unvaccinated people and because the vaccines are breaking that link between hospitalisations and fatalities. Nonetheless, it is going to be something of a gamble for the government if we do get to July the 19th, that so-called terminus date, as government ministers are now calling it, for restrictions to end. If we do see the current rate of case growth continue, we could be up at something like 80,000 cases a day by July the 19th. So government ministers will have to have some mettle to press ahead with full reopening in a situation where you do have tens and tens of thousands of cases potentially per day, even if they're not yet seeing that feed through into hospitalisations and fatalities.
Yeah, and I think this virus continues to shock us and surprise us. So those numbers would be very frightening to stare down indeed. I want to talk to you a little bit, Olly, about the drug ivermectin. It's a huge talking point here in South Africa. Our health regulator says the jury's out on whether it actually works, but has given the go-ahead for doctors if they feel so inclined to prescribe it for COVID. But it seems that we need more studies, and that's quite interesting because I'm hearing that in the UK that's exactly what's going to happen. Tell us more.
Yeah, a very large study here, starting with around 5,000 people and calling for more volunteers as we head into this study, which is part of the so-called Principle programme here in the UK, which is part of a process to try and work out cheap and easily accessible treatments that might be out there, that might be able to help head off some of the worst symptoms of COVID-19 and stop people going into hospital. And what we're going to see is the thousands of volunteers in this trial being given a course of ivermectin ivermectin, and they will be compared with people who just receive normal NHS care at the point which they test positive for COVID-19. And what the researchers for this trial say is that there is evidence around, some from laboratories and some from small-scale trials and some anecdotally from around the world, that suggests that ivermectin might have a positive impact on people who get COVID-19. It might lower the symptoms, it might speed up their recovery, but they say the data is not quite there yet and that you need more large-scale trials to be sure, and they say that's exactly what this trial will be able to deliver. So, as I say, a 3-day course of ivermectin, and then those people who've received it will be monitored for about a month. So we should start getting some data from this trial, or at least the scientists looking at the data should start to see some numbers in the not too distant future, and they therefore hope that after this trial is concluded, once the data starts to come in, they'll be able to have a real impact on telling the world whether ivermectin is indeed worth prescribing to people, giving to patients or not.
All right, well, thank you so much. That's really interesting to hear that news coming out of London this evening. That's our correspondent there.